Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Monday, November 16th, and this is our COVID briefing. I just want to say sorry I missed you all the last couple of weeks. I took a week off, and then last week I was extremely busy trying to get caught up on everything that I missed during the week that I was gone. So now we should get back to having regular briefings. So we've now had 3,604 cumulative positive COVID-19 cases in Missoula County to date, with 255 new cases since Friday. We've had 36 deaths associated with COVID-19 to date. Currently, 18 Missoula County residents and 18 non-county residents do remain hospitalized in Missoula County. We now have 1,076 active COVID-19 cases with an average of 5.4 close contacts per case. Those active cases and their identified close contacts remain in isolation and quarantine and are being supported as needed. Remember that all of these numbers, as well as the graphs and figures associated and additional information, is on our website at missoulainfo.com. The state of Montana is reporting 48,027 cumulative COVID-19 cases, which is up 869 new cases since yesterday. There are now 20,009 active cases in the state of Montana, with 453 active hospitalizations across the state. There have been 522 deaths related to COVID-19 statewide. The University of Montana has had 394 cumulative UM-associated cases since the beginning of fall semester, which is up 7 since yesterday, and there are currently 60 active cases associated with the University of Montana. Just a reminder that the University of Montana's fall semester is coming to a close, with the last day of fall semester being next Wednesday, the November 25th. So I have a couple of things to talk about today. First, I want to let you know where we are in terms of indicators. The goal with the increased restrictions was to get our average daily incidence rate to 25 cases per 100,000 people or below for 2 consecutive weeks. Currently, we are at 78 cases per 100,000 people in Missoula County. With that, I want to let everyone know that there is a public meeting of the Missoula County Board of Health. They will be considering staff recommendations to implement restrictions such as those covered under the most recent health officer orders. That Board of Health meeting is going to be on Thursday from 12:15 until 3, and it will be put out as a public notice. It is a Microsoft Teams meeting if you want to join in either by phone or computer. The comments if you would like to make comments on the action of the Board of Health on Thursday, please go to missoulainfo.com and use our feedback portal to submit your comments. The comments that are helpful for informing the Board of Health are those comments letting us know if you support current restrictions, think there should be further restrictions, or if you think there should be less restrictions. Our communications staff will be reviewing the comments that come in prior to 5 p.m. tomorrow, Tuesday evening, and compiling an analysis for the Board of Health to present to them at that Thursday meeting. Another announcement that I'd like to make is related to testing. While we have had the capacity to offer testing to all close contacts up until now, we are no longer have the capacity to do that. For easy math, I'm going to round today's numbers. If we have 1,000 active cases and each case has 5.4 close contacts, that's 5,400 close contacts total. We currently have the capacity to test around 150 people per day at our drive-through testing facility. Our appointments have been booking up really fast with people who are having symptoms. So for now, we will continue offering anyone with symptoms a test, and anyone who's a close contact that is having symptoms will also be able to get tested. But asymptomatic close contacts will not be offered a test at our testing facility for now. Once the numbers start to come down, we expect that we will be able to go back to testing all close contacts. We just don't have that capacity right now. Lastly, we've been asked a lot, where are these cases and where are these clusters? As we've been saying for a while now, we are giving it to each other. Many new cases are people who developed COVID-19 after being a close contact to someone who tested positive. Right now, we're seeing clusters of cases associated with parties such as Halloween or election parties. We see workplace clusters, particularly in smaller or shared office spaces where employees really work in close proximity to one another. We're seeing cases that are spread through overnight getaways with non-household members, and specifically people catching it from traveling in a vehicle with a non-household member. So just remember that it's important to practice social distancing, frequent hand washing, and wearing a mask or cloth face covering if you're going to be within 6 feet of anyone outside of your immediate household. So that's it for my briefing for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can check out our website at MissoulaInfo.com. There's lots of great information there. You can just click across the tabs at the top of the page. You can check us out on Facebook under the Missoula City County Health Department's Facebook page, and you can call 258-INFO if you'd like more information about COVID-19 or if you'd like to schedule a test if you are having symptoms of COVID-19. So until next time, everyone, stay healthy.